Alright class, welcome back, and today we're going to figure out why the phrase peeing like a racehorse comes into play. And the drug we're going to be talking about, of course, is furosemide. Now, to answer that question about the horse racing, they give this drug actually to horses to prevent the turbinates from bleeding in the big nostrils, but of course it causes the horse to pee some more. But that's why they give it, but that's why we give it to us humans, is to remove water. And so let's dive into what it is. What it does, it is again a potent diuretic that inhibits sodium and chlorine reabsorption in the kidneys. So it's kind of a good thing in one respect. The one thing it doesn't do, though, is it lets you pee out the potassium. We kind of talked about that in the video with all the potassium. So usually if they're on Lasix, they're probably going to be on some sort of potassium supplement. But again, it works in the Loop of Henle, so it's a potent loop diuretic. And it helps us balance out, again, and usually take the water off. We like this a lot for congestive heart failure patients, okay? And again, it decreases the preload by vasodilating. In about 5 minutes it has that effect. But the other thing that it does, though, is it causes an excretion of additional water through that Loop of Henle. So the diuretic effect kicks in about 5 to 30 minutes. Now, this kind of poses an interesting thing, and I will tell you this, that if you give a patient Lasix, or that matter, Bumex, while you're on the way to the hospital, hopefully you've got something, either a checkup underneath them, or hopefully something where you can catch the urine, because they're going to need to start collecting the urine and making sure that you watch our fluid balance with this. Yeah, when I say that they're going to pee, I assure you they're going to pee, and they're going to pee a lot. So again, usually the diuretic effect is about 15 to 20 minutes, but it vasodilates, and that's why we like it when we have a really bad congestive heart failure patient, is that it drains, it gives the fluid somewhere else to go. The other problem with that is, though, is then it starts going out the urethra because they start peeing a bunch. And then again, the duration of action is usually around 4 to 6 hours. So yeah, people on Lasix, you can tell they're on it because, buddy, they're headed to the bathroom every 15 minutes to make you feel better. Again, we use it in pulmonary edema. Again, it's to take the fluid out of the lungs and put it somewhere else. Again, and hopefully to pee it out so that it doesn't cause a fluid overload. If they actually have cerebral edema, we'll give it for that. If the patient has hypertension, we give this to help dilate out the vessels, reduce the preload, and then have them pee it out more, so in a kind of a roundabout way it lowers the blood pressure for these patients. If you give it too rapidly, you're going to get ringing in the ears. Definitely dizziness, headache comes into play. They can blur the vision. Again, if they have any type of arrhythmias, they can drop their blood pressure really bad. Those are the big ones that happen. And again, it also, nausea, diarrhea, vomiting, this can also happen with your Lasix administration. The other things that are kind of big is it drops your sodium levels, it will drop your potassium levels, it will cause your blood sugar to go up, it can cause actually metabolic acidosis. Pruritus is the itchy skin involved with that, so it can cause a little bit of a rash but again it dries out everything, so obviously it's going to lead to that nice big wonderful fancy word that I'm probably going to put in there somewhere. Alright, so back to it. When do we not give this? Again, you got to watch out in the MI setting, you got to watch out in cardiogenic shock. COPDers, again, it can cause some problems there. They are hypersensitive to sulfurs or thiazides. This probably is not going to be your drugs. You can actually give it in pregnancy, but it's got to clearly outweigh the risk. And there's way too many lists on that list. Most of the time, you're not going to see docs given that. Again, relative, if they got a low potassium, renal insufficiency, hypotension, probably better to stay away from it, especially if they got a low blood pressure. Again, remember, this is going to dilate the patient out. It's going to cause some problems. If they are on digitalis and they now have a low, you get there and you put the monitor on them and they got a really nice slow heart rate with a really wide QRS, you're probably going to be going, this is a bad idea, because again, it's probably going to make that situation even worse. Again, other diuretics you can really quickly volume deplete it. So don't give them Lasix and Bumex unless there's a clear fluid overload on that patient. And again, if you have sodium depletion, if they're on any type of lithium drug, again, they can become toxic from that. Again, we usually protect it from light, and if you give it too fast, you can actually cause them to go deaf. So please give this slow, all right? And the patient should be catheterized if the transport's going to be more than 15 minutes. Again, have a collection point for these folks. I would say catheterization nowadays, guys, is kind of a out of vogue thing. It's definitely out of vogue for us here in the EMS world. Again, just remember, it can really, if they start peeing a lot, they can lead to hypotension, and they can actually have a thromboembolism form inside. The blood starts to clot. And it's been known to cause fetal abnormalities, so with a pregnant patient, stay away from it. And pre-hospital administration is often overdosed. They usually give too much. And the reason is because usually the patient's in a severe amount of distress. Be judicious when you're giving this. A lot of places nowadays have actually taken the Lasix off the truck for these reasons. All right, usually the ones that I've worked with is 40 milligrams in the 4 mLs or the 100 milligrams in the 10 mL. Those are the big ones that I've worked with. It's usually 40 to 80 milligrams, 0.5 to 1 milligram over 1 to 2 minutes, a really slow push. If the patient's already on Lasix, we would double the dose. So if they're on 40 of Lasix, we probably give them 80. If they're on 20 of Lasix, we probably give them 40, okay? And the max dose of that, by the way, is 2 milligrams per kilogram. Child, it's, again, very rare. I don't think in 30 years I've given it to a child. So, again, but the dosing is the same for them. I know that it says pregnancy category C. It causes fetal abnormalities. Gang, I would not use it in a pregnant patient, okay? I would definitely not want to do it in a pregnant patient. All right, that's going to end it for Lasix, and I'll see you guys on the next one.